Record. Hi guys, we're group 4 and our pathogen is Histoplasma Capsulatum, and we're going to go ahead and start for you. So I'm going to share my screen.
Okay, so the causes are, it causes histoplasmosis. The fungus is found in soils, infects by breathing in the spores. It is commonly found in the Mississippi and Ohio River basins. Symptoms include chest discomfort, shortness of breath, cough, and fever. Historical background. This was discovered by Samuel Taylor Darling in 1905 while he was trying to understand malaria better. He named it Histoplasma Capsulatum because it enters the cytoplasm, hence plasma, and the histocyte-like cells, hence histo, and has a refractive halo that resembles a capsule, hence the capsulatum. The life cycle of it is when contaminated soil is disturbed, Histoplasma spores move through the air. People who breathe in the spores run the danger of contracting histoplasmosis. The person's body temperature enables the spores to turn into yeast after they have entered the lungs. The yeast can then go to the lymph nodes and spread throughout the body as a result of blood flow. The etiology. Common exposure-related tasks include farming, exposure to soils with bird and bat droppings, repairing and demolishing structures with bird or bat droppings, and removing trees or vegetation where birds have built their nests. It's caused by breathing it in. Breathing in spores of a fungus often found in bird and bat droppings. People usually get it from breathing in the spores when they become airborne during demolition or cleanup projects.
Hi, I'm Aaliyah. The route of transmission, Histoplasma capsulatum is transmitted through the respiratory tract. Cleanup and demolition projects can cause spores to float into the air. Bat and bird droppings can also carry the fungus and contaminate the soil, which puts farms at risk of contracting it. Affected organ systems. Histoplasmosis affects the lungs the most. In severe cases, it can affect the central nervous system, adrenal glands, skin, eyes, mouth, and liver. Epidemiology. The high nitrogen found in bat and bird species allows Histoplasma capsulatum to grow. The organism likes moist soil with a pH of around 7.4. Most cases are sporadic, but when numbers reach the thousands, it usually is linked to I'm sorry, I'm not a very good reader. Connated spores?
Yeah.
Histoplasma capsulatum is also found in caves. Mortality rates. The mortality rates are very low. A study found that 8% of adults and 5% of children in the USA die when infected with Histoplasma capsulatum. Another study said that 4% of patients with Histoplasma capsulatum die within 6 months.
Signs and symptoms. When it comes to signs and symptoms for histoplasmosis, most people don't even know they have the fungal disease because they don't show any signs. Common symptoms are cough, fever, fatigue, and headache, among many other things. According to the CDC, symptoms of histoplasmosis may appear between 3 to 17 days after a person breathes in fungal spores. Since this fungal disease can cause acute chronic lung disease, symptoms could be worse and affect other organs. And in this photo, a 21-year-old who suffered shortness of breath and dry cough. Both show distributions of acute histoplasmosis. Treatments. After doing some research on this fungal disease, treatment isn't always necessary for mild symptoms. But if symptoms aren't mild, it could lead to chronic lung disease, so you'll need to see your primary care physician. According to the CDC, there is some medications that can be taken. Intracortisol is used for mild infection, and amphotericin B is used for severe infections. Depending on the severity of the infection, the person's immune status, the course of treatment can range from 3 months to 1 year. Preventative measures. Although no surgery is required for severe pulmonary manifestation of histoplasmosis as of 2004, testing is important. Among a few different types of testing, the National Library of Medicine stated that antigen testing is most useful in patients with more diffuse pulmonary involvement in those with progressive disseminated disease due to the high fungal burden. Antifungal therapy is the most effective way to cure this disease and avoid areas where you're more accessible to getting it. Continue on preventative measures. Hopefully by the end of this presentation, you all know that histoplasmosis is a fungal infection that is brought on by breathing in spores, often left by birds or bat trappings. Sometimes this is hard to avoid if you work outdoors, such as farmers, landscapers, and even construction workers. It may be hard to avoid getting this, but there are some ways. These are some ways you can try. According to the Mayo Clinic, avoid exposure. Avoiding projects and activities that might expose you to fungus, such as cave exploring and raising birds, such as pigeons and chickens. Spray contaminated surfaces. Before you dig soil or work in an area that could harbor the fungus that causes histoplasmosis, soak it with water. This can help prevent spores from being released into the air. Spraying chicken coops and barns before cleaning them also can reduce your risk. Wear a respiratory mask. Consult the National Institute for Occupational Safety and Health to determine which type of mask will provide protection for your level of exposure. Thanks, guys. I'm going to stop recording.